Hello, everyone. Happy fall break. We are just here to tell you a little bit about the Charles Bonnet syndrome. So here is our further presentation. Please bear with us with some technical difficulties as we're all new to this system. Okay, so Charles Bonnet syndrome, which can be referred to as CBS, is a condition that is characterized by vivid and reoccurring visual hallucinations. These hallucinations may be simple or complex and often occur in adults with later life vision loss. Those who experience vision loss also experience CBS, and this is just a little visual showing what it might look like to experience the syndrome. So a normal person would see such like this, and those with CBS would see other features involved.
So some of the features of CBS are that it can occur soon after vision loss or several years later, and this vision loss might be due to cataracts, glaucoma, trauma, or macular degeneration. And people that have CBS experience fully formed images, and some of these hallucinations can be patterns, letters, or objects, and there's no sounds that are associated with them, it's just visual.
So Charles Bonnet syndrome was actually discovered by Charles Bonnet in 1760. He was a Swiss naturalist and philosopher, but he first saw symptoms in his grandfather, who was blind and kept saying that he was seeing hallucinations like carriages and buildings and things like that.
So the neurological explanation for CBS is when retinal cells are no longer able to obtain or transmit visual images in the brain. Clinicians have also defined it when the rods and cones stop working. Because the visual system stops working, our brains create phantom images through impulses from the visual cortex and makes up for the lack of images being seen. That's another example at the bottom showing you what it might look like for people with CBS.
And currently there's no accepted treatment for CBS, but there are certain strategies that doctors might encourage for patients to try and lessen the hallucinations, which include things like turning on a light or closing your eyes and reopening them, or shouting at the hallucination, or looking for something to distract yourself from it.
So one of the only relevant case studies that we found was of an elderly lady who's called Mrs. O. She actually first started having hallucinations after she had been diagnosed with macular degeneration, but she believed that her bedroom walls were covered with white fleece, or she believed snakes were coming out of the ground, or there were moving pink squares on her wall when she went to the doctor's office. People originally thought that she was just an elderly lady with dementia or had some mental health issues, but 6 months later it was found out that she had CBS, and she really felt that the diagnosis of CBS helped with her fear. She was really afraid that she was going crazy, and we have a video to show a few.
Well, I wakened up one night and to my horror, the walls appeared to be covered in fur, white fur or fleece or something of that kind. We have plain walls, but this was startlingly white, really brilliant white. Ceiling, the bed covers, everything covered in white fur. And that was, to me, the worst thing I had ever seen. I awakened my husband and said, I don't know what's happening to me. Everything's covered in white fur. And I got out of bed and clawed at the walls. And as I got up nearer to the wall, I could see that it wasn't there, but as I come back, it was there and it was everywhere. And it was then I thought, I can't live like this. I've got to find out what this is. I spoke to my GP about it at first, and he said no, he had no idea. And I was seeing him about something else, and I said, well, I sit here, your room's covered in pink squares, and they're all moving. He said, I have no idea what that could be. No, I really don't know what that is. I tried to get an appointment at the hospital, but they just kept saying you have an appointment for a year, and the clinics are full. So in desperation, I phoned the A&E helpline, And they said, come in the morning and somebody will see you. So I went into hospital in the morning and they just said the same thing. You see pink squares? And I don't know what that could be. And they sent me to the other hospital in the area where I saw a doctor there, and he said, what you have is scarring on your retina, and I'm afraid you have it for the rest of your life. There's nothing we can do about it. So I accepted that for a while, and I thought this must be what it is, until it really it was getting worse all the time. And the night that I saw the white fur all over the walls was really the end. And I phoned again, and I went there, and the man I saw said, as I said before, well, you're the lady who sees things, and he referred me to a psychiatrist. Now, the psychiatrist phoned me up, and we had a long, involved chat, and she said, Mrs. Sword, you don't need to see a psychiatrist, you need to see a good eye doctor. What I would like to have been able to do was to have found out immediately what was wrong with me. And I think that in the hospital, when you're diagnosed with macular disease, the best idea would be, if not the first visit, certainly amongst the first few visits you have to see your consultant, you should be told that you may see patterns and colours and things you can't understand. Don't panic. It's quite a well-known complaint. It's just something that happens because of your problem with your eyes. That would take away the fear. It's the fear of what's happening to you that you can't live with.
Okay, so a couple of statistics that we want to make you aware of are that CBS occurs in 10 to 40% of adults with vision loss, and the types of vision loss that they may occur in were explained earlier. A majority of these patients with CBS are elderly with a mean age of 70 to 85 years. Nearly half of all people who experience macular degeneration are thought to experience CBS. And up to 60% of patients with CBS are hesitant to tell their physicians because they believe they might be thought of as crazy or have a mental illness or dementia.
So some interesting information about CBS is that it's comparable to phantom limb, which is like having sensation in a limb that's been amputated, and you can learn more about that from the other presentation today. And the illusions that are associated with this syndrome are that they don't occur the illusions that are associated with CBS don't occur in conjunction with the other senses, so they don't involve hearing, smell, taste, or touch. And the hallucinations occur more frequently when the person's eyes are open rather than closed.
So some relevant quotes from other patients that we found were, everywhere I look, I see brickwork. When I look at my wife, her face is embedded with the bricks. Or another patient said, my walls are covered in these purple flowers. Even when I go outside, the lawns and pathways are a sea of these same purple flowers. Or I often see big cats like tigers and panthers, sometimes inside the house, but also outdoors. The images used to be scary for me, especially as they would appear out of nowhere, but now I can at least account for them.
Okay, well, thank you for watching. Here are references, and we have a handout which you guys can find the 3 questions for the day. So our first question is, which of the following senses are affected by Charles Bonnet syndrome? Choose all that apply. A, hearing, B, touch, C, smell, or D, sight. Our second question is, what is a recommended strategy to reduce the effects of CBS? A, closing and opening the eyes, B, turning on a light, C, concentrating on something else, D, shouting at the hallucination, or E, all of the above. Our final question is true or false. Charles Bonnet syndrome is more likely to occur in elderly patients. A, true, or B, false. Thanks for watching.